Thank you, Mr. President. Today, I rise to express my opposition to the resolution of disapproval currently before the Senate, which would decimate federal Title X funding for health care providers across our nation and provide vital preventative care and family planning services. Let me put it in simpler terms. Republicans in Congress are, once again, rushing to advance legislation that will make it harder. It will make it harder for Michiganders to get the health care that they need. Just last week, we saw Speaker Ryan and President Trump in their efforts to take away health care to 24 million Americans and to fund Planned Parenthood. But this is a new week, and we're seeing a new assault on health care. Today's resolution is just the latest in a long series of attacks against Planned Parenthood. A vote for this legislation is a vote to make it harder for millions of Americans to access birth control, cancer screenings, and testing for sexually transmitted infections. Title X funding sounds arcane, but it is actually pretty straightforward. It is a bipartisan program established more than 40 years ago that provides individuals with family planning and preventative health services. Not one penny covers abortion. Let me say that again. Not one penny covers abortion. Not one. This is established federal law, and anyone who says otherwise is simply lying to you or has no idea of what they are talking about. We should take a step back and ask, what can we agree on here? And I think that, every senator would agree that we want to reduce unintended pregnancies and teen pregnancies and save money and prevent cancer. Well, today, unfortunately, we are voting to do the opposite. Right now, we have the lowest rate of teen pregnancies in our nation's history, and we are getting ready to heavily restrict a successful program that saves $7 for every public dollar invested. Preventative screenings are quick, they're affordable, and save lives. Cancer devastates families, ends lives, and is expensive to treat. Historically low teen pregnancy rates did not happen in a vacuum. It happened because of concerted efforts to promote education and prevention and give women a say in their own health. The pain inflicted today will not be felt uniformly. It will disproportionately hurt people in rural and underserved areas where these clinics are, more often than not, the primary source of health care. Michigan has 19 Planned Parenthood clinics, and half are located in areas federally designated as rural and medically underserved. Michigan family planning clinics, as a direct result of Title X funds, prevent over 18,000 unintended pregnancies and over 1,000 cases of sexually transmitted diseases and cervical cancer each and every year. Every woman has a fundamental right to make her decisions about her reproductive health. The government has absolutely no right to stand in her way. I strongly oppose this resolution and implore just one more of my Republican colleagues to join me in stopping this misguided effort.